The depression is a serious condition that can affect people's ability to feel, think, and behave. It's not normal day-to-day sadness which all of us experience. The symptoms are very persistent. They can negatively affect the patient's ability to function in their daily lives and also experience any happiness and joy in their lives. Some of the more common signs and symptoms of depression include generally depressed mood and sadness that persist throughout the day, lack of energy, lack of interest into day-to-day activities, inadequate appetite, either eating too much or eating too little, weight gain or weight loss. Also, the sleep pattern can change. You get socially isolated, and also inappropriate feelings of guilt, irritability, lack of focus and concentration. Along with that, it can lead to the frequent thoughts of death and even thoughts of suicide. The diagnosis of depression requires a personal interview by a mental health professional or a medical physician and physical exam, and certain lab tests which can be done to rule out some of the medical illnesses that can lead to depression, or their symptoms can mimic the symptoms of depression. Yes, depression is twice as common in women as compared to men, and 20% of the women in USA suffer from depression. Generally, the life cycle, the unique chemistry the women have, the hormonal changes, and some of the psychosocial factors contribute to the higher prevalence of depression in women as compared to men. Women are very prone to getting depression on birth of a child. Generally, it has to do a lot with the physical and the hormonal changes, and of course, the stress of being a new mother. It's very different than the baby blues, which is a little sense of sadness the woman will feel for the first 10 days after the birth of a child. But if it lasts longer than 10 days and it gets more serious and persists, then it needs active treatment by professionals. The treatment of depression generally requires the use of medications and talk therapy. They can individually help too, but in combination they work much better. Of course, in older age, the people are prone to getting depression, and sometimes they do diagnose for the first time later in life with the illness of depression. There's a lot of factors involved with that. Of course, the losses that can include the death of a family member or the loss of your functioning, along with some of the physical changes, because the blood supply to our organ system is low when we get older, including the brain. And when the blood flow to brain is restricted, it can lead to the chemical changes that can ultimately lead to the symptoms of depression. And of course, the depression can coexist with some of the illnesses like stroke and heart attacks. Yes, definitely there are different ways we can attempt to treat depression, and it is treatable. A lot of depression can be managed without medication. It can require the lifestyle changes like meditation, the yoga, along with that stress reduction strategies, exercise, proper use of the diet. The dietary supplements like fish oil can be used and be helpful. Along with that, the light therapy, intense light exposure have been used to treat the depression. Midday exposure to the light can relieve some of the symptoms of depression. Along with that, when the depression is not properly controlled with the medication, people have used the electric shock treatment, which is called an ECT, electroconvulsive therapy, or some of the magnetic TMS, transmagnetic stimulation, to treat the depression.